Safeguarding. Assessing need and providing help, Part 1. Introduction to the module. This module explains what safeguarding is and why it is necessary for children. You will learn how you can help protect them and what legislation has been put in place to safeguard children. The different approaches to safeguarding will be discussed, and you will gain knowledge of how to assess needs and provide early help to vulnerable children. You will also learn how to share information with the relevant people. Topics covered in this module are: what safeguarding is and why it is necessary for children. Legislation created to help protect children. Who is responsible for safeguarding children? Child-centered approach to safeguarding. Coordinated approach to safeguarding. Assessing need and providing early help. Access referral and information sharing. Introduction to safeguarding. Safeguarding refers to the protection of young people, vulnerable adults and particularly children, from abuse and maltreatment. It promotes their welfare, human rights and well-being. Safeguarding children is protecting them from abuse, harm and neglect, regardless of their gender, disability, age, religion, beliefs, race or sexual orientation. Preventing harmful effects on their physical and mental health or development. Guaranteeing that children and young people have secure and beneficial care. Taking measures and action to ensure all children receive optimal care and minimized risk. There are various policies and legislation which have been developed and updated to safeguard children. These include the Children Act of 1989, amended in 2004. It emphasizes that children's safety and welfare are the priorities, and it is best for them to be looked after by their parents, unless essential intervention is necessary, due to the children being in a dangerous environment. When deciding what services to provide, local authorities should listen to children's wants and needs. The United Nations Convention on the Rights of the Child, UNCRC. This international government organization is child-centered and fights for and protects the rights of children, so they will be provided with the relevant services to help them. The UK government managed to get children's rights to self-expression and the need to receive information recognized and added to the legislation in 1991. Female Genital Mutilation Act, 2003. FGM is illegal in the UK and is a form of child abuse when carried out on young girls. It involves partial or total removal of the external female genitalia for non-medical purposes, often performed by particular cultures who believe it will preserve a girl's innocence or deny her of pleasure. It is dangerous, a form of torture, and has long-term psychological and physical consequences. The Child Care Act 2006, amended in 2018. This act focuses on the duties of UK local authorities regarding the safety and well-being of children. It includes childcare inspection plans and regulations. One of the updated responsibilities for local authorities is improving the Every Child Matters initiative, which the UK government created for children and teenagers, and up to age 24 for those with disabilities. One of the main messages of this initiative is for children and young people to stay safe. The Safeguarding Vulnerable Groups Act, 2006. An act created for the protection of children and vulnerable adults. It states that all those who work with vulnerable groups must go through an advanced screening process. People who are banned will be listed. The Equality Act, 2010. This act requires public authorities to promote equal opportunities and eliminate discrimination, both in person and in assessments. It protects individual children and groups of children. They should all be given the same chance to access services which will help them. The Disclosure and Barring Service (DBS) Check, 2012. This check was created for the purpose of safeguarding. It is a combination of the Criminal Records Bureau (CRB) and the Independent Safeguarding Authority (ISA). As stated in the Protection of Freedoms Act, 2012, the DBS check allows employers and other organizations, such as religious groups, to help ensure the safety of children from people that might pose a risk to them. The check determines if someone has a criminal history. The Children and Social Work Act, 2017. This act details various changes so that safeguarding children and promoting their welfare will be the priority, creating consistent, high-quality procedures to protect children and meet local needs. This will be achieved through a multi-agency collaboration approach with a focus on sharing information. It puts new responsibilities on local authorities, the police, education, and health agencies to work together. The Act includes how children and young people are educated about sex and relationships. Secondary schools are required to teach the topic of sex and relationships. Primary schools need to teach about healthy relationships. Making it compulsory to provide social, health, personal and economic education. Offer adopted children and those with special guardianship extra educational support. Creating new procedures for reviewing the deaths of children and serious incidents. Introducing a National Child Safeguarding Practice Review Panel. Who is involved with safeguarding? Anyone who is in contact with children ultimately plays an integral part in the process of safeguarding. This applies whether they are a leader of a sports club, a teacher, or a family support worker. There are several organizations and people responsible for safeguarding children, such as directors and senior leaders of organizations that provide services to children and families, CEOs of local authorities, chief officers in the police. Every practitioner and organization should have policies and procedures in place, in line with the legislation for safeguarding children. Child-centered approach to safeguarding. A child-centered approach refers to putting the child's needs as the #1 priority when making decisions about their lives. This is crucial to safeguarding and focusing on their well-being. Anyone who works with children must acknowledge them, listen to what they say, take their views seriously, work closely with them and their families to understand what each child requires, talk to them in a friendly, caring way. Certain types of vulnerable children will need special assistance when conversing with them. Children with communication problems, unaccompanied children, refugees, victims of trafficking and/or modern slavery. Children can experience abuse and maltreatment from members of their family, as well as other people they can come into contact with. There are various types of child abuse, including neglect, physical, emotional and sexual abuse, trafficking, exploitation by criminal groups, such as county lines, who are gangs that groom and exploit children to sell drugs, sexual exploitation, both in person and through the internet, online abuse, through social media, influence of extremism groups, recruiting children online and leading to radicalization, female genital mutilation (FGM). Research into children's needs indicates that children have asked for the following requirements from safeguarding: protection. To be given protection against all types of abuse and discrimination. Refugees need special protection and help. Support. To be given individual and family support. Vigilance. For adults to notice when things are causing children distress. Understanding and action. To be listened to, understood, and appropriate measures are taken to help them. Respect. To be treated with respect and assuming that they are capable, rather than not. Stability. To be able to form lasting, stable relationships with practitioners or organizations who are helping them. Information and engagement. To be informed about necessary information, plans and decisions, and to be involved in them. Explanation. To be given reasons why individual decisions have been made, if it's not what they wanted, and to be told the results of assessments. Advocacy. To be given advocates to help their views be heard. Coordinated approach to safeguarding. A coordinated approach refers to everyone who works with children and families, working collaboratively to keep them safe. Each practitioner, organization, and agency has a responsibility to identify anything that concerns them and share this information with the appropriate people and act quickly. Everyone should be knowledgeable of their role and the roles of other practitioners. They should also know and follow the official plans detailed by local safeguarding partners. Assessing need and providing help. Early help. The earlier help is given, the better. As soon as a problem is identified, support should be provided, whether it's for a young child or a teenager. This can also prevent future problems from occurring, for example, in families where substance abuse is starting. Practitioners, local authorities and organizations need to work together to provide early help effectively. This can be done by identifying children and families for who early help would be most beneficial, carrying out assessments to determine local early help needs, targeted services to help put into action the outcome of assessed needs of children and families, local authorities promoting multi-agency coordination to enhance child welfare. Identifying children and families who would benefit from early help. Practitioners, local authorities and organizations should already have in place successful procedures for identifying potential problems in children and families. This can be achieved by sharing relevant information with each other, multi-agency training to understand local needs, identifying the triggers and symptoms of neglect and abuse. Vulnerable groups of high-risk children should be identified who will likely need early help, such as disabled, who require extra support, children with special educational needs, young carers, those exhibiting signs of antisocial or criminal behavior, children that often go missing from home or care, children at risk of exploitation, trafficking, or modern slavery, children at risk of radicalization, where the family environment poses a risk, such as parental substance abuse, mental health issues, or domestic abuse, when the children themselves have substance abuse issues, when they have come out of care and returned to their family, privately fostered children. Effective assessment of the need for early help. A lead practitioner, for example, a family support worker. Depending on the case, should carry out assessments to see what support services the child and family need and if they require early help. They can also be an advocate for the child or family. They may need to work in partnership with other local organizations and agencies, such as the police, housing, or education agencies. If so, an interagency assessment should be undertaken. A practical assessment will identify what support the child and family need to stop situations escalating to dangerous levels, where urgent intervention would be necessary from local authorities, as stated in the Children Act of 1989. These assessments should conclude with a clear plan of action, stating the support and services that will be provided to help the child and family. For an effective early help assessment, the child and their parents need to agree to it. If this isn't possible, the practitioner needs to decide how the child's needs can be met, as stated in the Children Act of 1989. The child's feeling should be taken into account. Their family circumstances, age and the wider community need to be considered. Practitioners need to be able to discuss concerns with a social worker. Provision of effective early help services. Following assessment, local authorities and clinical commissioning groups must provide quality, evidence-based early help services that should be part of a wide range of further support available to children and families. These need to match local needs and the results of the effectiveness of previous early help programs. Combined with other services, local early help support often offers support with health issues, including mental health, assistance with emerging problems, such as a child or parental substance abuse issues, or domestic abuse, programs for parents and families. These may focus on family communication to improve the family's ability to solve problems themselves. This should be reviewed frequently to ensure progression in the child's situation, even if the support is given to the parents. Access, referral and information sharing. Accessing help and services. Every local authority, organization, and agency who deals with children must state clear criteria and procedures for taking action. They need to provide a wide range of help for all vulnerable children, including those with complex needs, and who might be suffering from harm or neglect, as stated in the Children Act of 1989. They should consider the following: the process for gaining an early help assessment, and the type of early help support that can be provided, and at what level of need, low, medium or high. The criteria for referring to children's social care services. Clear procedures for cases involving children who have been abused, neglected, or exploited. Children in the young people's secure estate. Disabled children. Referral. If anyone has concerns about a child's safety, they should make a referral to their local authority's Children's Social Care Service. The local authority is the main point of contact for child-related safeguarding concerns. This should be done immediately, if there is a chance the child could be in danger. The local authority's Children's Social Care Service is responsible for clarifying the referral process and must provide their contact information for anyone who needs to make a referral, get advice and/or support. When referring a child, practitioners should include any information on the child's developmental needs, and if the child's parents can meet those needs. If they think a child could be a victim of human trafficking or modern slavery, then they must refer them to the National Referral Mechanism immediately. Children's social care services should give feedback to the referrer on their decisions. If the case doesn't meet the criteria, they should provide suggestions for more suitable support. If practitioners aren't satisfied with the response, they need to share their concerns. Information sharing. It is essential for practitioners, local organizations and agencies to share relevant information and or the police as soon as possible. This is crucial, regardless of whether the problem just started or if social care services already know about the child. This should include anything necessary about adults that the child is in contact with who could be a danger to the child. This helps to identify the need for help and assessments early, so services can respond quickly to safeguard the child. Every organization or agency needs to have known procedures in place for sharing information, both internally and externally. Priority must be the safety and welfare of children, and this needs to override any worries about sharing information. If a child has disappeared from home or care, information sharing can be critical to identify behavioral patterns. Also, it can be investigated whether other children can be linked to the same location or situation. Advice for practitioners. Be vigilant when a child is moved from one local authority to another, as vital safeguarding information could be lost. Try to get consent to share information. Except in situations where this could put the child at risk or harm, or if it is impossible to get. The Data Protection Act, 2018, allows practitioners to share personal or sensitive information for the purpose of safeguarding. Record who the information has been given to and why. When deciding to share or withhold information. Summary. In this module, you have learnt the importance of safeguarding children, that anyone who is in contact with children is responsible for safeguarding them and must contact the relevant service if the child is in danger. There has been a lot of legislation created to help protect children, and these laws are regularly reviewed and updated in response to current needs. There are new threats to children's safety, such as extremist groups using the internet and social media to recruit and radicalize children. Practitioners, local authorities, organizations, and agencies need to use both child-centered, putting the child's needs first, and coordinated, working together and sharing information, approaches to safeguarding. Vulnerable children need to be identified and assessed quickly, so that early help can be provided.